Tourists have never been as welcome as they are now. The coronavirus pandemic has put the brakes on tourism. In Berlin, everything came to a standstill for weeks. Pleasure boats, once filled with sightseers, are now mostly empty. Hotels and restaurants also worry that people will stay away.
We have to show we're still here. We're responsible for the livelihoods of 45 people.
Usually we're booked at 80% capacity. Right now it's around 20%.
The industry faces huge losses. Now people who depend on tourism hope that the coming month will bring a turnaround as visitors put the lockdown behind them. Welcome to our COVID-19 special here on DW News. I'm Monica Jones in Berlin. Good to have you with us. Now, normally, they'd be everywhere, crowding beaches, mountaintops and inner cities, leaving their rubbish behind and lots of cash. But this year, the coronavirus pandemic has kept tourists away, giving nature a break. As for the people depending on tourism, they suffer and look for new ways of making a living.
For these women, cleaning the river is the only job they can do at the moment. Due to the coronavirus pandemic, there is no tourism and business is at a standstill. Nelson Olerea initiated the cleanup. He pays each woman $5 a day as part of his effort to restore the ecosystem of the Nashulai Maasai Conservancy.
This is the most important watershed in this part of the Mara. The local community relies on this water for their usage, for cooking, cleaning, and even also the livestock and wildlife. Unfortunately, the river is heavily polluted because of the activities of the urban areas upstream, the tourist camps.
All the way to that pool.
Olerea and his wife co-founded the conservancy. Located right next to Kenya's famous Masai Mara National Park, Nashulai is run by the local Maasai community. Unlike other nature reserves, wildlife, people and livestock exist here side by side, a balance that is supposed to help the community preserve its traditions, but also help protect wildlife and the environment.
And the biggest problem facing wildlife today in Kenya is not actually poaching, as people might actually think of it. It is the lack of space. And that space is with communities. So communities have to be at the center of conservation.
This area always belonged to the community, but with the creation of the conservancy, the people pulled down the fences and worked to restore the land. After 2 years, wildlife was able to return. To sustain this, they rely on funding from donors as well as tourism.
Tourism makes up about 20% of the Conservancy's income, and this is supposed to be the peak season. But the arrival of the corona crisis has made it clear that relying on tourism only is not the answer.
While Nashulai has managed to refocus on its conservation activities, they have also had to provide food aid to the communities of the Mara region. Many of the people here work as guides, rangers in hotels, or sell local jewelry to tourists. The entire region's main source of income has been derailed. Additionally, local markets have been closed, disrupting trade in the area.
Everything has become difficult. Getting food is a problem. There are diseases all around us. We're just locked down at home and can't leave the village.
For the people here, it's a lifeline, and it could be another year before tourists actually start returning to the region.
So we need a paradigm shift in the conservation movement to find out other alternatives to sustain the important work that is done in conservation.
While the effects of the pandemic have devastated the region, Olerea hopes that this change will also give people the chance to build more resilient communities.
And for more, let's bring in Jane Stacey. She's the head of the tourism unit for the OECD Centre for Entrepreneurship, SMEs, Regions and Cities, and she joins us in Paris. Good to have you with us. Please tell me, how's the tourist sector in OECD countries coping with the pandemic?
Thank you for having me. The tourism has been, as your report mentioned, it's been really hardly hit. It was one of the first sectors to shut down, and it will probably be among the last sectors to open up. Estimates from OECD at the moment project that the impact will lead to about a 60% decline in international tourism in 2020. And that could actually rise to an 80% decline if recovery is delayed until the end of the year. So we're seeing a big impact. Domestic tourism offers the best chance for recovery in the short term. It's about 75% of the tourism economy in OECD countries, but it won't be enough to compensate for the shock to inbound tourism. And I think another point is that this shock with tourism is having a significant impact on the wider economy, particularly in countries, cities, regions where tourism supports many jobs and businesses. In OECD countries, it's directly 4% of GDP, but it's higher than that in many countries like Portugal.
Right. I mean, the economic impact, and with those figures, they really underline that, is enormous. But at the same time, maybe there's an upside to it, because before the pandemic, there was a lot of talk about the negative impact of tourism on communities, cultural heritage, wildlife, and so forth. Perhaps now is a good time to rethink the concept of tourism, and if so, what would be the key points?
I think, as you said, before the crisis, it was very much talking about overcrowding, the pressure tourism growth was putting on infrastructure, the environment. And these are issues which we have been looking at in the OECD. And I think that issue of how do we redefine tourism success, because we need to find a better balance between the costs and benefits of tourism. Tourism can bring benefits, jobs, businesses, sports businesses. It can support local culture, but it does also bring costs and impacts when it is continuous growth, when it is unmanaged growth. So I think we really have an opportunity now to, as the sector needs to be rebuilt, and that the measures that are put in place today will shape tourism in the future. That we can build a more sustainable model of tourism. And there's a lot of talk at the moment about building tourism back better. Yes, at the moment we're very much in survival mode within the sector, and the challenge at the moment is opening up tourism destinations, welcoming visitors, while at the same time managing the virus, which is still circulating. But I think it's also good to be thinking more.
Yeah. What you say, I mean, there is this balance that we must be able to strike somehow to serve both the economy of those tourist destinations, but also keep people safe and healthy. This virus certainly reminded us of how vulnerable we are from a tourist perspective. What are the lessons learned?
As I said, I think at the moment the priority is protection of workers, survival of businesses, and governments moved really quickly. The next step will be moving to the lessons. I think it's still a little bit early to make concrete judgments on the lessons, but there is a clear need to address how to make the sector more resilient to these shocks, but also to address those wider issues that we just mentioned around unmanaged tourism development. So we see governments are already moving in this direction to try and balance the immediate crisis response with preparing for a longer-term recovery that is more resilient, that is more sustainable. Countries like New Zealand, for example, are undertaking a reimagining of the tourism sector. So I think there's a huge opportunity there, and it's somewhere where your report mentioned local communities. I think local communities really need to be central to that, along with the private sector, along with governments, to work together to determine what kind of tourism we want in the future.
Yeah. It actually sounds exciting when you say it that way. Jane Stacey there from the OECD Tourism Unit. Thank you so much. Time now to answer your questions about COVID-19. Over to our science correspondent, Derek Williams.
Why was Europe so badly hit?
Around a quarter of all cases of COVID-19 worldwide have so far been counted in Europe, and it slid into crisis earlier than North or South America. The first big outbreak in northern Italy took off in late February, and within just a few short weeks, Europe had become the epicenter of the global pandemic, although that title later passed to the US. Looking back, I think Europe, especially Southern Europe, was initially hit so hard because it was hit so quickly after China, and Italy's healthcare system in particular was caught off guard by the speed and the momentum of the spread. The number of new cases in Europe peaked at around 40,000 a day at the beginning of April, but it's since dropped to less than half of that.
What is the current coronavirus situation right now in Europe after countries started easing their lockdowns weeks ago?
Every country in Europe pursued its own version of lockdown, and all have been cautiously easing restrictions during the last few weeks, but each has its own timeline. So it's hard to make blanket statements, but there are a few things that you can say sort of in general. Shops have reopened pretty much everywhere, and schools in the majority of countries as well, while domestic restrictions on movement have been lifted across the continent. Travel restrictions between Schengen countries have also largely been eased. So tourism is very slowly ramping back up again. Although I do think that a lot of Europeans will remain within driving distance of home this summer. Most countries still don't allow large gatherings or events, though. In general, I'd say the feeling is one of relief that the initial crisis, at least, no longer seems to be spiraling out of control, but it's mixed with a lot of anxiety about a possible rebound in the coming months.
What do you do to get better when you start having symptoms and you lack access to a doctor, much less testing?
If you develop symptoms consistent with the disease but don't have access to proper health care or testing, there are still things the WHO says should be done, starting with limiting the number of people who take care of you in order to limit the possible spread of the disease. As we still lack medications for treating milder forms of the disease, therapy at home has to focus on easing symptoms through rest and making sure, of course, that you stay hydrated and taking pain relievers that can also help you reduce your fever. But if you begin to develop warning signals like unexpected confusion or a persistent pain in your chest, or if you have difficulty breathing, or if your face begins turning a bluish color, then it's very important to seek whatever professional medical care is available in your area.